Okay. Actually, that leads to my next question, which is why is it important to be proactive in learning about breast cancer and raising awareness?
So cancers tend to be easier to manage. It's easier psychologically on the person. It's easier financially. They don't pose such a high burden when they're diagnosed as early as possible. So the reason we want to be very proactive in awareness is because we want the public to try as much as possible, so they can, if something is abnormal, they're able to get to a health facility very quickly, because cancers generally fall within stage 1, 2, 3, and 4. And 3 and 4 tend to be difficult to manage because the cancer is advanced. Typically, it has spread even beyond where it started. But with stage 1 and 2, you're looking at a disease that's localized. It's only within one breast. It's easy to go around it, to either remove it surgically, to focus radiation on it, or chemo. So it's easier to actually get treated for stage 1 and 2. And the options are people tend to respond better when they're diagnosed in stage 1 and 2. So why we want to be proactive is so that the population, so that women are aware, and that in that way they're able to seek services a lot earlier, because it makes treatment and care for them a lot cheaper for them, easier financially and psychologically on them and their families as well.
Okay, great. So the last question to you is, how can we all contribute to spreading breast cancer awareness, especially in our communities?
Okay, absolutely. I think as women, we tend to be carers for other people. I think October gives us an opportunity to be carers to each other. So we can begin to spread this message. If you come across this, you can actually share it with other women in your circle, men as well, just to try and reach out to someone in the community, a loved one, someone at your workplace, someone at the market that you come across, and remind them that actually it's October and it's Breast Cancer Awareness Month. And this month is usually the pink ribbons that we wear. If you put on yours and a woman comes across you and sees it, she quickly remembers, it's Breast Cancer Awareness Month. So that subconsciously raises awareness in them, and they're able to even remember to do the self-exam by themselves, or even go to a facility. So for me, my call is to each woman to reach out to another in the spirit of sisterhood and remind them, and to either have a self-exam done or to refer them to the nearby facility.
Okay, great. Thank you so much for that insightful information and all the information that we've been able to receive about breast cancer. Thank you so much, Dr. Pahe.
Thank you, Stella, for having me.
Great. So PS Kenya works with the Tunza Health Network facility providers to provide breast cancer screening, while at the same time empowering women to self-screen regularly. Our primary goal is to increase detection of breast and cervical cancers in their early stages, as mentioned by Dr. Pahe, and hence improve prognosis and reduce the number of preventable deaths. Together, we can make a difference in the fight against breast cancer by closing the care gap. Thank you.